Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting technologies from the world of health IT. I'm sitting down with Robert Krayn, CEO of Talkiatry, and we're going to talk about the explosive growth that was enabled through their work with eClinicalWorks. Robert, welcome to the program.
Thanks for having me. I appreciate it.
Robert, before we dive into the questions, I want to ask you about how you deployed eClinicalWorks and what the difference it's making for your organization. Tell me a little bit more about you and your organization.
Sure. So my name is Robert Krayn. I'm the co-founder and CEO of Talkiatry, which is a nationwide group behavioral health practice. We operate exclusively through telemedicine across the country and predominantly employ psychiatrists and therapists to provide in-network psychiatric care to hundreds of thousands of patients throughout the country.
You were just up on the main stage, and I loved how you were talking about the fact that you were the IT person and how you actually implemented eClinicalWorks and you were all the tech support. Tell me more about that.
My co-founder and I, Dr. Gaveras, we started Talkiatry together in 2019, but we launched and saw our first patient in April of 2020. So very interesting time when people were struggling to try and figure out how do you switch to telemedicine. And we actually created Talkiatry not to operate exclusively through telemedicine. It kind of just fell into our lap, if you will. But it was incredibly small. I think we launched with 6 providers total on our platform, and we employ all of them, right? So it's not a 1099 marketplace or anything like that. And I think we had maybe 3 support staff, if you will. So I was the clinical informatics specialist, right? If this audience would get that. And so now we have a great team of people that do that, but setting up eClinicalWorks, setting the rules, the revenue cycle component, adding providers, all of those different things, navigating Helo because we do all of our training virtually as well. So yeah, in the beginning it was all of that. I think I still get calls. It's my number is still out there somehow.
So you were basically the IT person. You were the person that implemented eClinicalWorks. That was possible because of what eClinicalWorks is, right? They're cloud-based, and so it allowed you to be that one-person show for a while.
Yeah.
But we were talking about how the platform really allowed you to expand. I think you were telling me about how you were able to add a provider matching program on top of eClinicalWorks.
Yeah, I mean, we started out with 6 providers. We have 400 now, and so we're a fairly large specialty provider group in the country. And I think we have our own technology team now. So even outside of clinical informatics, we probably have close to 30 engineers, whether it's on the data side or on the application side of things. And we like to build nuanced technology that's specific to us. Okay. And so things that an EMR says, well, even if I had, a bunch of behavioral health clients, you might want something completely different. And so we have to build custom things that aren't even really related to the medical record, if you will, right? So you had mentioned a matching algorithm, which is something that we were incredibly focused on because a psychiatrist is not like a primary care provider, right? A psychiatrist can specialize in age ranges, they could specialize in diagnoses, they could specialize in treatment modalities. So it's incredibly important that when a patient is coming to Talkiatry, that they're going to get matched with the doctor that's best suited to treat them. We believe that will result in the best possible outcomes. And so building that from scratch as we were scaling so rapidly was something that was incredibly important to us. But if you didn't have an EMR which could support that and work with you as you grow, and now we have our own internal support versus relying on eClinicalWorks, but the fact that they can kind of be with you throughout that entire career arc, I think is pretty rare. A lot of times people have to switch EMRs as they continue to scale, which ultimately anybody who's watching this knows that is a nightmare, right? And I think causes really significant business interruption. So if you think that you will create a really large scale or even stay small, if you will, eClinicalWorks is honestly one of the best options that we've seen and obviously, the best option in our opinion.
Talk to me a little bit more about that openness, because if you're building your own apps, you have to be able to integrate with the EMR or the EHR that you've chosen. So how is that achievable through eClinicalWorks?
To be honest with you, I remember I went to Massachusetts and I met with Girish and we were talking about what our growth plans were and things that we would need to do that. And he looks at me and he's almost looking at me like, we are the ones who started the openness component. Like we are the ones leading that piece. So that we're the only people to do that with. Everyone else is behind us, And I think that was a very different tone from what we've seen from other EMRs who say one thing, but then there's certain things that are like, we're open on this, but we're not open on that. And ultimately, I think it does the practice as a disservice to a certain level, and forcing you to work with one specific thing. And I think eClinicalWorks has been really amazing in working with us to try and create these things that I think ultimately adds to the capabilities on their platform, especially as you've got these really sophisticated practices, coming to market and say, what's in your tech stack, what's in the backbone of what you do. And for us, one of those is eClinicalWorks for sure.
That openness has allowed you to integrate with hospitals and other organizations to do e-referrals. Tell us a little bit more about that. Yeah,
so obviously accessing a behavioral health provider is incredibly difficult. The majority of counties in the US, believe it or not, don't have a psychiatrist. It's a crazy statistic to think about these days, even less so if you're looking for a child and adolescent psychiatrist. And so the wait times are incredibly long. And a lot of times these health systems, they focus on screeners. They look for people who have depression, anxiety. But then what if you identify someone who has that? What are you supposed to do with them now? You've got a 3-week wait for an appointment, if you can even get one. There are health systems who don't have, who manage millions of lives and have, less than 10 psychiatrists. Most of those people will never get care. It's really unfortunate. And so what we've done is partner with large health systems, but also with primary care groups and specialty groups across the country to integrate into their EMR. And with eClinicalWorks, it's very easy. eClinicalWorks actually allows us to integrate with other EMRs as well. So it's really amazing to be able to do this. Where the specialist or the primary care provider can just click a drop down, just like they were referring inside their own health system, if you will, select Talkiatry. We receive all the demographic information, insurance information. We automatically reach out to the patient. They're our patient now. We treat the patient. But then we close the loop with them and say, by the way, this is what happened with your patient, of course, with patient consent and everything else. But, being able to customize different flows, not every health system or group wants the same flow. They want to send different information. They might want to receive different information. So you really need great partners to allow that whole ecosystem to flow. And they need to see it their way, whether it's in eClinicalWorks or a different EMR. And my doctors need to be able to see it in eClinicalWorks and the progress notes and things like that. And so you've got to have the interoperability there to connect all of those pieces.
I really liked how you talked about closing the loop there, because that is a piece that's missing a lot of times, where you make the referral and then it's like a black hole. And we have to rely on, frankly, the patient to tell the originating doc what happened. You're closing that loop completely because you have the capabilities.
And again, a lot of people who don't have certified EHRs, believe it or not, 45% of psychiatrists don't even use a certified EHR, right? So there are tools that EHRs have, whether it is direct messaging or direct trust, for example, which make it, you don't need to have a big engineering team do an integration into this, right? It's already built into eClinicalWorks and other EMRs. And so it's just like adding a phone number to an address book, add our direct trust address, and there you go. And now we can start doing these sorts of things, and your patients automatically get access, to a really high quality provider group that focuses on behavioral health.
I'm sure the direct trust folks are very, very happy you talked about that, because yes, it is such a great way. It's sort of a replacement for fax, right? You just put that number in and then instantaneously all that information just flows electronically right into the record.
Yeah, it's one of the fastest ways to kind of get up. There are other ways to integrate that, have different benefits, but the direct trust is a simple way to do it and kind of allows people to get started quicker.
What's next for Talkiatry? What are some of the interesting things you're working on over the next 12 months?
Yeah, I think Talkiatry is going to continue to move to implement value-based care in behavioral health. It's something that a lot of people talk about. It's something that's incredibly difficult to do. And in behavioral health care, you don't necessarily have control over all of the healthcare costs like a primary care physician does, for example, right? And so you really have to collaborate with your insurance partners and with that patient's other providers to focus on that, and looking at outcomes among that patient data. And so one of the things, obviously we have very structured data in eClinicalWorks. We get data from elsewhere, whether it's claims feeds from our insurance partners and things like that, or through our own intakes, and we're collecting different pieces of information. And we can look at that every day, if you will. We can do studies on our patient populations and really look at people and are they getting better, and which doctors are providing which outcomes for which types of conditions and subset of patients, and then work to identify the cost savings that exist there. And ultimately, everybody wins in that scenario, right? The patient's getting better faster. It's costing them less co-pays, less co-insurance, less deductible, for example. The insurers are paying less because the patient's getting the right care faster. But it's something that people have really struggled to do. And it relies really heavily on technology. And a great answer is there's no blood test for depression or anxiety, right? So how are you really understanding how this patient is doing? And it's by getting all of that information in the right format, in the right place, in the right hands is the important piece. And that's how you can do it. So those are some really exciting things. We're already rolling some of those out with some of our payer partners and things like that, but we're going to continue to work on that.
Final question for you, Robert. If there's a psychiatrist watching this, listening to this, who is not on an EHR or certified one, what would you say to them to encourage them to go ahead and adopt one?
Yeah, I would just say that it really is designed to streamline your workflow, and it's not designed to make it messier. And you probably have a patient list in Excel. You probably, I don't know how you e-prescribe, but it's a different system. You know what I mean? You might use Zoom to do telemedicine. I mean, I think the reality is that eClinicalWorks is a great option for someone who's just getting started because they've got all of these things saying, oh, do you want to do telemedicine? It's here. Do you want to do billing? Maybe, maybe not, but it's here, right? And so all of that is there, and you can expand and use all the different facets as you'd like. And when we were first getting started, that was really, really important for us. And then again, it was able to allow us to scale and say, how do we become even more sophisticated to fine tune this for exactly what we're doing? How do we build pieces and make sure that they connect all while still operating on eClinicalWorks?
Robert, where can people go to find more information about Talkiatry?
Talkiatry.com is probably the best, to be honest with you. And depending on who you are and what the interest level is, whether you're a health system or someone managing a physician group and interested in making referrals, for example. I mean, my team is on LinkedIn. Derek Wilson leads our strategic partnerships group. But of course, people can message me as well, and I'm available.
Awesome. Robert, well, thank you very much for being on the program today and sharing all this wonderful information.
No, I appreciate you having me. It's been wonderful. Thank you.
It's been great.
Yeah.
This has been Colin Hung with Healthcare IT Today. If you enjoyed this interview as much as I did, we'd love for you to like and subscribe. Plus, head on over to healthcareittoday.com where you'll find more great content like this. I'm Colin Hung. I'll catch you on the next video.